So Joyce, critical to any of these kind of episode designs is for the providers who are participating in them, like large practices like yours, whether they're a commercial payer or an OCM, is usually developing guidelines internally so that the practitioners kind of are aligned and they have a consistent approach so that you can model the cost and and the leaders of the practice on the administrative side, can gain some control over that. And so, I know Texas Oncology well. You've had extensive guideline work, Clear Value Plus, among others. Notable things. I don't know what your level of involvement is in the breast cancer pathway development, but I'm curious with what you do know, if you can share that process and then how it translates at the front line doing patient care.
Yeah, sure. The Texas Oncology is part of the U.S. Oncology network around the country, and the most of the guideline work is at the U.S. Oncology level. Across the country, various leaders, practicing oncologists, many of them kind of subspecialized in their knowledge base, et cetera. But basically, they've adapted the NCCN guidelines, and Bill leads the breast cancer guideline development for NCCN. They do have a bit of a cost overlay. That's the Clear Value Plus. So they do make some judgments if they think that the efficacy of a particular treatment is marginal compared to the comparators, and the cost is quite a lot more. They'll make the judgment that should be off the pathway, even though it may be listed as an option on NCCN. There's only a few examples of that in breast cancer. But so it's a way to basically, as you said, get a handle on cost, basically. And the NCCN is a very broad-based approach, evidence-based approach, and so it's quite a reasonable set of pathways. In Texas Oncology, I think maybe each practice does it a little bit different. The expectation is that 75 to 80% of patient care across all malignancies and across from first diagnosis till end of life, about 75 to 80% will fit easily within the NCCN guidelines, but that 25% of the time, for a variety of reasons, patient-specific, that the guideline will not exactly fit that particular patient. And so there's flexibility, of course, to go outside the guidelines, off pathway, we call it. And from a mechanical standpoint, it's actually quite easy. It's not a cumbersome thing when you are entering your orders into the electronic medical record, which is called iKnowMed in US Oncology. Basically, if what you've chosen is off pathway, basically a screen comes up, and you basically just type in, your reason for wanting that, and that will go to. There are regional oncology directors, so these are practicing oncologists, regional directors who look at it, and basically. All
right, so Joyce, I just got to ask you.
Yes.
Because it gets back to that question from before. So, have you ever been turned down when you've gone outside a pathway by a regional director?
No, I